Good morning, everyone. I'm Robert Dempsey, and I have the honor of chairing the Foundation for International Education in Neurological Surgery. Today, we have a wonderful webinar about postgraduate fellowships. As you know, education in neurological surgery, especially in low and middle income countries, has been a primary focus of organizations such as FIENS and worldwide neurosurgery to bring the level of care up to the same standard worldwide. A big part of that has been forming residencies, but an equally important part is the postgraduate and finishing education provided by fellowships such as the Bassett Fellowship, one of the FIENS Fellows, which takes finishing residents and junior faculty from low and middle income countries and brings them to high income countries where there may be a very refined program which allows them 3 months of finishing. These Bassett Fellowships have been a foundation of FIENS and now are being duplicated worldwide. Today, we're honored to have 2 people to represent these programs. One of our Bassett Fellows, Soumia Benallag, from Africa, spent 3 months at the Barrow Neurosurgical Institute under Dr. Michael Lawton. The Barrow is one of the finest neurosurgical institutions in the world, famous for not only pioneering neurosurgical techniques, but also for education and global education. So we'll get to hear about these programs, how integral they are to refining the education of the new leadership of neurosurgery worldwide, these young people, and how this fits in the mission and creativity of the established programs. So to start us off today, Soumia, would you be good enough to introduce yourself, tell us a little bit about yourself and your country and your neurosurgical aspirations and how that fit into this fellowship?
Of course. Thank you, Dr. Dempsey. Maggie, please, can you share the screen? Good morning, everyone. I'd like first to start by introducing myself. My name is Soumia Benallag. I am a neurosurgeon from Algeria. For those of you who don't know, Algeria is a country in North Africa. It is a land of contrast and complexities. Next page, please. Our history is a mosaic of influences ranging from ancient Berber civilizations to the rule of various empires, including Roman, Ottoman, and French. Despite centuries of external influence, Algeria has retained its identity, guarding its language, tradition, and customs. Our diverse landscape, from the Mediterranean coast to the Sahara Desert, mirrors the diversity of our people, united by our Algerian heritage. Next slide, please. When it comes to healthcare, we face challenges typical to many developing countries. The legacy of colonialism left its mark on the healthcare system, and despite significant strides since the independence, disparities persist, especially in rural areas. Following the independence in 1962, the rise of neurosurgery in Algeria started with Dr. Abada, who emerged as a pioneer in the field, laying the foundation for neurosurgical practices in the country. His pioneering work paved the way for the establishment of the first neurosurgery departments, which served as beacons of hope for patients. However, until today, the challenges are daunting. With the population of over 40 million people, we grapple with the lack of neurosurgeons, numbering around 400. The burden of neurological diseases, compounded by limited resources and an overburdened public health system, underscores the urgent need for innovation and collaboration. Despite these challenges, Algerian neurosurgeons have made remarkable strides and progress with the rise of microsurgery and vascular surgery in the last few years. Next slide, please. The journey towards excellence is far from over. We recognize the important role of international collaboration and education in advancing our field. That's why through partnerships and fellowships like the one I took part in, we seek to develop our knowledge and skills, bringing cutting-edge techniques and best practices back home. International fellowships provided by organizations like FIENS are instrumental in advancing the capabilities and expertise of Algerian neurosurgeons. These fellowships empower neurosurgeons to acquire new skills, build international networks, foster personal and professional growth, and contribute to the overall enhancement of neurosurgical care in Algeria. I'm very grateful for being selected for this fellowship, and I'm committed to paying it forward by giving my best efforts. Thank you.
Thank you very much, Soumia. A wonderful explanation of where the importance is. I will point out that these fellowships have been helpful in numerous countries: Uganda, Nigeria, Egypt, Pakistan, Zambia, Malaysia, Jordan, Algeria, Paraguay, Vietnam, Ethiopia. And they are possible not only by generous philanthropists, but also by the generosity of the people at the established programs that are interested in paying it forward worldwide and educating and meeting such bright people. It's also important that we learn from you when you come. Dr. Lawton, could you tell us a little bit about the Barrow Institute and its role in global health, as well as these programs? Thank you.
Thank you, Robert. Let me share my slide or my screen here. Good. Well, first of all, thanks for putting on this webinar, Robert, and the rest of the FIENS team. I really appreciate what you're doing here and appreciate the opportunity to participate. So I'll just briefly talk about where I began and how I ended at Barrow, and just sort of take you through the Barrow program briefly. So for me, why global neurosurgery? Well, I think it just answers this unmet need. It's all about eliminating health disparities and elevating the neurosurgical craft, as Robert mentioned. And at the end of the day, it's about helping people. It's good old-fashioned doctoring, and sometimes our system gets so complex that you really need to escape our system in order to experience that good old-fashioned doctoring. And lastly, for me, it's this idea of striving for something better and bigger. For me, it began with writing, and I look at the books that I've written as a way to impact global neurosurgery. This is just a quote from a surgeon in Ireland, and she sent me this email not long ago and said that when she started and split her first fissure, she read 7 aneurysms. When she did her first AVM, she opened up her book and read about the AVM she was working on. And she says, on Monday, we're doing a Stamka, and 7 bypasses is on my computer right now. And I feel like writing is a way to really capture your ideas and connect with the people who are looking for those ideas. And for the books that I've written, 7 aneurysms was all about aneurysms and taking the steps of the surgery and reducing that to a choreography, much like a dance, so that people could understand the steps and replicate them no matter where they are, whether they were in high-income countries or low-income countries. Same with AVMs, trying to take that same stepwise approach, apply a taxonomy to the variety of pathology that you see, and then transmit that system of going through that operation safely. Bypasses was about developing a new language for these constructs and putting together blueprints and maps and concepts for putting vessels together and revascularizing. And lately I've been finishing up this book, Cavernomas, and it's about cartography and maps and bringing all these various ideas about selecting your approach, your craniotomy, looking for anatomical triangles, knowing your safe entry zones, all the things that go into a safe journey from the outside to the inside to your target lesion, and getting the lesion out safely. This is an important slide about the neurosurgical need. 3 times more deaths worldwide from unmet surgical needs than HIV, AIDS, tuberculosis, and malaria combined. There's this surgeon's shortage, which is particularly acute for the subspecialists. The ratio of neurosurgeon to patient in the US is 1 to 65,000, and in low and middle income countries, it's 1 to 10 million. So those numbers are really quite staggering. There are 5 million neurosurgical procedures left undone each year, due to this manpower shortage and a need for an additional 20,000 neurosurgeons. So this is the demand problem and the need that we're faced with. When I began this with Alfredo, we started Mission Brain. This is Alfredo Quinones, who most of you know. Wonderful story about his rags to riches journey from Mexico as an illegal immigrant to a student in a community college in California, to Harvard Medical School, Berkeley, and finally to UCSF, where I had the opportunity to train him as a resident. He's now chairman at Mayo Jacksonville. But, we started this whole process of these medical missions that began here in Guadalajara. And you can see these are some pictures from some of our early trips, wanting to go on these 1-week trips and try and impart some of the things that we had learned with this philosophy that if you give a man to fish, you feed him for a day, teach a man to fish, you feed him for a lifetime. And that was the philosophy. And, we kind of believed in that at the time. We also embodied this idea where if you could show people that it happens in their operating rooms, that it must be possible, that they too can take on these kinds of cases and do the kinds of surgeries that they were seeing us do. And we did this quite a lot. These were some of the posters from our trips, but we also began to realize that maybe we weren't doing as much good as we thought, that maybe our comings and goings were too brief, that maybe we needed a different paradigm. And that's when Mission Brain started to shift. We started focusing on student chapters and getting more students involved and letting them showcase the work that they were doing and listening to them to see what they thought the needs were in global neurosurgery. And this was really an amazing thing. I was really taken aback by the numbers of chapters that sprung up around the country and around the world. I think at last count, there were 67 Mission Brain chapters around the world. And, the Mission Brain chapters did things like sponsor these webinars and talk about partnerships and health equality issues with some great speakers like you can see here. This idea of the hackathon was brilliant. This was something that, again, I was sort of taken aback. I didn't really understand what a hackathon was, but these students at Harvard, like Han Razik, they put together this incredible program where students competed to try and solve problems and put together ideas and startup companies and devices. And it was just an amazing outpouring of ideas and innovation. Other things that Mission Brain did was, come up with this scholarship, the Lisa Hannigan Humanitarian Neurosciences Scholarship. She was my clinical nurse in San Francisco who had a tragic end, and we honored her with this scholarship, which helps neurosurgeons observe and train and travel. And so Mission Brain has undergone those kinds of changes, and I think for the better, from a simple mission-style, mission-driven organization to one that's really exploring ideas and innovation worldwide. This kind of takes me to the Barrow Global Initiative. And to summarize what we're trying to do at the BNI, it really comes down to this: delivering quality care without leaving home for the patients, and receiving quality training without leaving home for the clinicians. That's really what this is about. And, the mission is to create a sustainable learning environment that improves neurosciences care in underserved populations worldwide. So that's our vision, that's our mission. And luckily, we were able to get a generous donation from one of our philanthropists in Phoenix to endow this initiative. And that money is invested. And so we get a certain amount of return on the investment, which we then use to fund the work that we do annually. So that's how we've set this up. We've focused our efforts in Tanzania. And this was a picture taken when we signed a memorandum with the Kilimanjaro Christian Medical Center, formalizing our partnership. You can see Dr. Spetzler in the front row there, the leadership of KCMC some of our foundation leadership. And here is Delan Elagala, who's our director of the program over in Tanzania, where he has a long history of his work. This is a picture of the people now making this happen. So here's Delan. As I said, he's the director of our Frankie Global Neurosciences program. Carrie Vaughn is our first Frankie Fellow. So she spent a year with us. She's over in Tanzania now, and she's a graduate from UPenn who's spending her first postgraduate or post-residency year doing this. This is Brian Wilhelmi, one of our anesthesiologists, and we have people regularly rotating to KCMC to set up the services. One of the first things we got over there was an endoscope, and you can see Carrie in the middle here teaching the team there how to do endoscopic endonasal surgery here. And part of our initiative is to get resources like endoscopy and all the equipment to the facility like this. This is a Zeiss Pantero microscope. We worked hard to get this donated by Zeiss and shipped over there. And now here's Happiness Rabiel doing one of the first microscopic surgeries there at KCMC with her team. And so this is sort of what we're up to. The program has all of these various things. We've got a global neurosurgery fellow. We've got a spine research fellow. We have about a half a dozen neurosurgery skull-based research fellows that work in our teaching lab. This is an opportunity for them to do cadaver dissection and develop their technique on cadavers. We have international clinical observers, which is what Soumia was with us. The Global Neuro Nurse Fellowship is a program that's beginning just now. We have some mission trips that are also starting to begin. Dr. Reset, our neurology chairman, has a very robust program with the University of Witwatersrand in South Africa. We have a robust adjunct faculty program with Dr. Rousseau, who I know is on this call, and Dr. Hagland is another one of our adjunct faculty, as well as others in Phoenix, like Dr. Gibbons, who's with ASU. We have programs for undergraduates and high school interns who come and get exposed to medicine early and turned on to the specialty. And ultimately, we have plans to expand into Latin America, which is where the Frankies have an interest in making an impact. So part of what this is all about is the teaching, and this is our daily teaching round where all of our residents assemble and we go over cases and talk about new consults and cases for tomorrow and learning points from the day. It's a really wonderful environment. And, you know, when I think about our legacy as teachers, I used to believe that it was in the papers we wrote, and there was such a focus on writing papers as a resident and even as an attending. It's the whole publish or perish idea. But, you know, this is how I look at my publishing career over my lifetime. It's quite a big number, but the question is, have I made an impact through the things that I've written in the journals? And I think, to be honest with you, I'm a little underwhelmed at the impact that all that effort has translated to. And I actually think that the greater impact is in the human contact, the face-to-face, or even the virtual contact. And so the observership has really become an important thing because it brings people in. They get to, it's not about reading the papers. It's about seeing me and the other faculty doing our cases, how we manage the patients, how we interact with the other residents. By having an observership, they come and they experience that. And part of what we try to do is to capture that almost as a virtual experience with taking the best cases from the week and translating those into videos that end up on 7 series or posted on social media. I've become a believer in what I call the highlight reel. And let me just play this. This is just showing Michael Jordan coming in and doing the dunk. It's to make a point. You know, I think what captivates people sometimes isn't always the sitting in a room for 3 hours and watching a case, but it's the highlight reel. And sometimes these videos um, are exactly that. They're recording really exceptionally talented surgeons, just as they do athletes at peak performance, and it establishes a standard of excellence in the sport. And I think the same is true in surgery. They're both archival and aspirational. I find that people analyze and replay these, and they use the videos to try and elevate the game. I think neurosurgery really, when you think about it, is this blend of cognitive and physical skill, what I like to think of as surgical athleticism. And so, like highlight reels, neurosurgical videos are educational resources that they share the nuance, they empower better surgery. And I think these become a priceless teaching tool that's available to residents and neurosurgeons around the world. So I've really embraced this social media change. I think the idea of videos is really great. I wrote something recently for neurosurgery at Doug Konziolka's urging, which I called Publish, Post, or Perish. And the idea is, you know, the old edict was to publish or perish, but in today's world, in that perspective of people not being so fixated on reading the papers, it's about the posting. I think however you can reach out and connect with the audience, whether it's Twitter, X, Instagram, Facebook, whatever, it really is important. And just as a proof point, somebody posted this not long ago. It says, "Thanks for your contribution. It cures lives around the world." I think that's so true. It really, I think it's the way that we can connect and bridge these connections with people who have interest. So we've tried to capture that daily teaching round, which I showed you in the form of Barrow Base Camp. It's basically just capturing some of those moments that we have as a team, talking about cases and putting that out there as a series of episodes. And when you put it all together, it, I think, creates what I like to think of as a virtual residency where everybody can join in. I think residents need mentors beyond their faculty, and they find them through these videos and social media connections. It transcends time, travel, prescribed rotations, and expense. It democratizes and disseminates the training experience. And what I love about it is if I teach 7 residents or 28 residents, whatever the number is in a particular program, I impact those particular individuals. But when you democratize it and spread it out, you can influence thousands. And I think that's where the power of this is. We can push residents and young neurosurgeons around the world to a higher level of proficiency and raise that bar of excellence. We put together what we called Barrow TV. So if you go to our website, you can find libraries of all these videos. And, you know, I think it's a nice resource for those who have interest. So I think this is my last slide, you know, going back to why global neurosurgery, answering that unmet need through sustained global service and training, trying to eliminate healthcare disparities at targeted sites and beyond, elevating the craft of neurosurgery by displaying how we do things, helping people, old-fashioned doctoring, and then striving, in this case, to develop a virtual neurosurgical residency that will improve neurosurgical care globally. So that's what I wanted to share with you. Thank you for letting me share that.
Well, thank you, Michael. I think probably the most important thing that I'm hearing is that there's a standard of care in neurosurgery which is extremely high, and people are deserving of that worldwide. We do not dummy it down. We really strive to train the next generation of trainers at such institutions as yours, and worldwide through the young people who connect us electronically so beautifully. And I think the lessons learned during COVID, when the inability to travel was stopped, and yet the education was fostered even greater through these electronic connections, is really a lesson learned from a time of crisis that'll be continued forever. It's phenomenal work.
Yeah,
Excellent.
I think that's when we really kicked it into gear. We were
Absolutely.
chugging along, and we had this extra time, and it really was kind of a spark to get us going.
And it came not from the old people, but from the young ones who said, hey, listen, this is how we connect.
Yeah.
And just add that information to these formats we like. Soumia, could you tell us a little bit about the nuts and bolts of your experience, and maybe also highlight how this will change you from a passive learner to a teacher? Because that's really what doctors are. So please tell us about your experience.
Thank you. Thank you. Maggie, can you please share the screen again? Yes, the next slide, please. The next one. Thank you. So after completing my fellowship, I came to appreciate the privilege I had been granted with this opportunity. So when I was asked to share my journey, I eagerly took the chance. I wanted to assist others in navigating the application process and to enable them to access similar opportunities. My journey began with a simple aspiration. I wanted to expand my expertise in neurological surgery through international exposure. With my limited exposure to vascular neurosurgery, just a few procedures and mostly textbooks, I still realized that I'm fascinated by the subspecialty. I wanted to learn from the best, but considering my limited resources, I knew that I needed help. That help came in the form of the FIENS Bassett Fellowship that I found on the WFNS website. After doing enough research on the FIENS and the work done by Dr. Dempsey, I was sure that the Bassett Fellowship was the solution I needed. Next page, please. Applying for the FIENS International Fellowship was a surreal experience. Each stage of the application process heightened my anticipation, culminating in the amazing feeling of winning the fellowship. That was an unparalleled opportunity for both my career and personal growth. As an Algerian neurosurgeon, our health education system differs slightly from the American one. After completing medical school, we enter a 5-year residency program. Following this, we undergo what's known as service civil, a form of public service where doctors are deployed into rural areas to address the shortage of medical professions in those areas. Upon completion of this mandatory service, Algerian neurosurgeons can apply for what we call concours de maîtrise. Completing an international fellowship is a huge plus in this application process. This opportunity came at the perfect timing for me. Not only was I thrilled because I knew I would have an amazing learning experience, but I was also excited about the career boost it would provide. Next slide, please. After overcoming the initial disbelief of winning the fellowship, I embarked on my journey to Barrow. The process was exhilarating, and the prospect of visiting a place vastly different from what I was used to was both thrilling and scary. However, upon arriving in Barrow, I realized that the experience was going to exceed all my expectations. My initial impressions were colored by the Institute's reputation for excellence, a reputation that was exceeded by the warmth and hospitality extended to me by everyone, from the administration office to Dr. Lawton and his team. Their genuine welcome set the stage for an immersive experience. Next page, please. Meeting Dr. Lawton was a defining moment in my journey. His reputation in the field preceded him, yet nothing could prepare me to his humility and generosity. Shadowing Dr. Lawton has been an extraordinary experience, providing insights into the world of neurosurgery. Our days typically begin with morning rounds, where Dr. Lawton leads discussions on various cases and surgical techniques, helping us understand the rationale behind different approaches. Following rounds, we accompany Dr. Lawton to the operating room. There, we observe him and his team perform surgeries, many of which we only read about in textbooks. Seeing these procedures firsthand enhances our understanding. The whole team patiently explains the techniques being employed and readily answer our questions, enriching our learning experience. On Wednesdays, we accompany Dr. Lawton and his team to the clinic, where we observe firsthand how he interacts with patients, addresses their inquiries, and engages in discussions about various treatment options. We also attend the grand rounds, where we gain deeper insights to the work of the Barrow Neurological Institute team and other institutions. These sessions serve as platforms for sharing knowledge, discussing challenging cases, and exploring innovations in the field of neurosurgery. Next slide, please. My journey at Barrow was enriched further by the privilege of meeting other personalities in the field. Meeting Dr. Spitzler was an unforgettable experience. Listening to him talk about his groundbreaking work and witnessing the rise of Barrow Neurological Institute was inspiring. Equally captivating was meeting Dr. Sontag, learning about his pioneering work in spine surgery and international education initiatives. During my time at Barrow, I also had the opportunity to tour the neuropublication department. I was fascinated to discover the medical illustration program. It was a concept entirely new to me as it's not available in my country. Next slide, please. One of the most unexpected yet rewarding aspects of my journey was the opportunity to connect with the fellow observers from around the world. Despite our diverse backgrounds, we were united by our shared passion for neurosurgery. Throughout our time together, we bonded over our common interest, learned from each other's experience. Inside the walls of Barrow, we immersed ourselves in the world of neurosurgery, soaking up knowledge and insights from the team and Dr. Lawton. While outside of the hospital, we explored the city of Phoenix and the stunning landscape of Arizona. Our adventure extended beyond the operating room. One of the highlights was the hikes. I'm particularly proud of our Camelback mountain hike. It was a very memorable and yet challenging experience. Next page, please. My time at Barrow has not been short of transformative. The wealth of knowledge and experience I gained during my fellowship has left me feeling incredibly inspired and motivated for the future. I'm excited to apply everything I've learned, building upon the foundation already laid by Algerian neurosurgeons before me. I am eager to delve deeper into vascular neurosurgery and explore techniques that can benefit my patients and our healthcare system. One of my primary goals is to support the next generation of neurosurgeons in Algeria, especially aspiring female neurosurgeons. By sharing my experience, I hope to inspire them to pursue careers in vascular neurosurgery and contribute to the ongoing progress of this specialty. Next slide, please. In conclusion, I am filled with an overwhelming sense of gratitude. First to FIENS for granting me this amazing opportunity, and to Barrow for opening its doors and embracing me as part of its family. My experience has not only enriched my knowledge and skills in neurosurgery, but has also shaped me into a more compassionate physician. To anyone considering applying for the FIENS Fellowship, I implore you to seize the opportunity with both hands. The journey might be challenging, but the rewards are immeasurable. Thank you.
Wonderful. Soumia, I think probably the most important thing I heard is that during your education, you were inspired to teach others.
Yes.
And to inspire, especially women in your home country. This is a wonderful approach, which is necessary for us to provide care for people who aren't even born yet. We need your youth, your ideas, your excitement to embrace teaching in your own land, because that's really what doctors do. And so with that in mind, Michael, could you talk a little bit about what you benefit from these interactions and what enrichment this gives to our profession when we work with people of this creativity, energy, and youth, and your experience of working with Soumia in particular?
Yeah, well, I'm always amazed to just gain perspective. You know, we get a little bit of tunnel vision. We get used to the kinds of cases that we do and the resources that we have. And when the observers come and they talk about what they have or don't have back home, it's really eye-opening. I think I benefit from the perspective that the observers bring. But I also, it really helps keep me going to hear these reflections on how the experience changed them, like Soumia's. You know, she was there for so many months and was there for every case and every teaching round. And just to see how this has changed her, and she's back home and bringing that back to her her colleagues, her teammates, and that helps to keep me going. I think it's really why we do this. It's sort of a cycle of or a chain that we are building, and we touch another person, they touch another person that they're around, and that chain just continues the propagation through the world, and that's really what I think helps reinforce this process.
Yeah, and I think like through the FIENS Young Neurosurgeons program, where the alumni of these fellowships gather together, they generate ideas, they generate common education. They are our future, and they are the energy of the future too, which is really the success, because Dr. Lawton's a very fast surgeon, but there are 5.5 billion people with need. So we cannot do this alone. We absolutely positively need these fellows to take this back to the area that they know. And in doing so, they teach us. One of the things, Mike, I always learned from the trainees is new techniques. I'm absolutely stunned by the things they can do with minimal equipment. And I begin to sort of humbly realize I don't need all the toys that I started with. Have you noticed that?
Oh yeah, yeah. I have learned the power of medical tape, for example, and rubber bands, things that you know are so simple, and yet when people are not blessed with some of the resources that we have and all the fancy equipment, sometimes tape and rubber bands is really what gets them through a tough case, and it's remarkable the little tricks we learn from them.
Yeah, and I think just like blood loss, the people say, how come your patients never have any blood loss? And the answer is, well, there's no blood to give in Africa. So you better have a clear understanding of the blood supply, et cetera. And that imperative means so much. Excellent. Jeannie and Maggie, do we have questions from the audience for our panelists at this point?
At this point, no, I think Maggie's answered the questions that were live. I don't know if we want to open it up, Maggie,
Okay.
anyone else, if there's any other questions?
And Maggie, I think one of the questions was about the application process for this. Could you tell them a little bit about where the information is for fellowships? And then I'll sort of expand that there are many types of fellowships in this world, and I want people to be aware of them. Maybe you could start with the FIENS fellowships, Maggie.
I think Jeannie would be the
Or
one.
Jeannie, okay.
Yeah, no problem. So on the FIENS website, there is a section under fellowships, and there you can click. Soumia has been through the process. There's just two different choices. There's the Clack Family Fellowship, and then there is the Bassett Fellowship. You can click, and then you can fill out your form, and then it tells you about the cycles and the process. You fill out a form, and then you'll hear back from the FIENS team has two different committees, and each committee, Dr. Rousseau, who I believe is on the call, she was part of the committee for Bassett. So these busy doctors, they find time to review the applications. And once they've reviewed and they've fairly graded all of the applications, then they make their final decision. And then we reach out to all applicants to make sure they understand whether they were awarded or not. And we invite everybody to reapply if they weren't awarded. It's very, very competitive. There is only so much resources for so many applications, but we continue to strive to increase that amount so that we can award as many as possible. And then we just really look forward to communicating with the fellows through their journey. I had the privilege of speaking to Soumia while she was actually in Arizona when she first arrived via WhatsApp, and she sent me pictures, and I just got to, and Maggie actually too, we got to share in the excitement of her journey. Which was really nice because usually we don't get to hear from the fellows until after they've completed their fellowship. So having that communication is really important. It's a priority of Dr. Dempsey's to make sure that once someone has become a fellow of FIENS, that they're always part of the FIENS family and that they stay committed in communication so that FIENS and the team can also offer additional resources after their fellowship. So we definitely invite everyone to apply on the website.
Yeah, which is fiends.org. Now, it's very important to know that this is a mechanism that brings us together. The fellows, the alumni, through the Young Neurosurgeons group are very active in transforming the way we approach education and the way we do it. And the idea of postgraduate education becomes imperative if we really want to maintain a high standard worldwide. And many FIENS members, such as Dr. Qureshi in Africa, really pioneered these programs that will support a young trainee as they begin to be established in their home country, either with volunteers that can come to visit or with boot camp programs or graduate education programs. It's important to know that this has been, something that FIENS has really taken a large role in with fellowships through philanthropy, and is expanding that with individually focused fellowships, some for areas of need, some for programs. But as this has developed, places like the Barrow through their Franke Institute, like Duke, are also beginning to develop funding for such fellowships as well as an integral part of their global education program. So it's important to scour the internet and these electronic avenues, and we'll be glad to help with that as well. But it is a very important part of not only getting started, but maintaining your education throughout. Because neurosurgery is a lifelong learning experience. And if we don't continue to improve or learn, we will atrophy and our patients will suffer, because nobody really wants to be treated by the techniques of the past. I don't want to be treated by the way my professors taught me, and I want you, the trainees, to supersede the things we teach you today. That's the way we will deliver better and better care for glioma, stroke, pain, congenital anomalies of children, aneurysm, AVM, only by constant improving. So a big part of these fellowships also, especially say the one we have here, is that the fellows are involved in the creative process of improving the techniques in the simulation labs and the cadaver labs, etc. And that's really an essential part of their ongoing education. Are there other questions?
Dr. Dempsey, there's a question, and actually I wanted to give Dr. Lawton an opportunity. I answered one of the questions about how they can apply directly at Barrow as well for some of your opportunities. So I put that in the chat on one of the answers. But if you have any other suggestions of where you'd like people to apply, that's the first question, and then we have one more after that we can talk about.
Yeah, usually people who have an interest in coming to Barrow usually either email me or the particular faculty member that they're interested in working with or observing. So I routinely get a lot of emails, and then we have an office that helps to arrange these observerships. And with the Franke Institute, as things develop, we anticipate having some support in the future for observerships for people to come, and that will probably be through a website and an application process, not unlike what you've described for yours.
Okay. And that's the same for rotational opportunities as well?
Yes.
Okay. Thank you. And then Abdullah Kilis is on the call, which is fantastic. Thank you for joining, Abdullah. And he actually talks about his project, the Madison Microscope Initiative. I don't know, Maggie, if you're able to let Abdullah speak briefly about that. Is that possible to unmute him?
Yes, let me find him on the list.
Wonderful. Thank you. And actually, Dr. Assini, I believe, is here too, who is the he's the committee lead for the young neurosurgeons. And so maybe if there's an opportunity for him to have a really brief hello after as well.
I think that'd be great. So Abdullah is one of the research leaders here at UW-Madison. And his particular work coming out of our preparation, simulation, and courses for surgical techniques is to transport this knowledge worldwide of microneurosurgery, and with electronic connectivity to really magnify it from 1-on-1 to 1-on-70 and such. Abdullah, are you able to tell us briefly about that? And then maybe Ignatius could tell us about the alumni of the fellowships who are now organizing as young neurosurgeons. How are we doing, Meg?
Sure. Thanks for the opportunity, Dr. Dempsey. So here at UW Medicine, we established Medicine Back Surgery initiative in 3 years ago, and we start to provide free, accessible, and sustainable training opportunities to healthcare professionals and support them via offline, live stream, and in-person trainings in their home countries. And we try to support them with our donation of basic and advanced microsurgery training. And so far, we reach out 19 countries and 31 centers, and already donated 71 basic microsurgery training kits, include stereo microscope and instruments for basic microanastomosis practice. And as we did here at UW Medicine, we always try to support FIENS Fellows with our donations, and we would like to increase our numbers with collaboration with the FIENS and all other FIENS Fellows in the United States. Thank you.
Thank you. So what Abdullah does is in our labs runs the microneurosurgery courses where people learn micro techniques, but he decided to take it online and developed inexpensive but very reliable microscopes that nobody leaves here without having them in their suitcase to take back to their country, and then can electronically connect with the students in that home country, where he can teach them online micro techniques using simulation techniques, which are fantastic and have really revolutionized, for example, South American micro techniques, as well as Mideastern and African. So extremely good work, and came directly out of these programs. Is Ignatius there? Ignatius?
Yes, sir. Yes, I'm here, sir.
Very good.
Thank you so much.
Could you tell us a little bit
yeah.
about your efforts to organize these past fellows, the alumni, so that their education and their impact continues worldwide?
Thank you so much, Professor Dempsey. Thank you, Professor Lawton, for the excellent talk, and Dr. Soumia. I didn't know, she was one of the alumni. So one of the things FIENS is trying to do is to keep track of all the past fellows, so as to see, to follow up to see what they're actually doing after their training, which is very important because their feedback is going to help to reorganize the way FIENS is doing its her activities. So to keep track of all our alumni, we've decided to put up a WhatsApp group where we have all the fellows there, and then also people who are interested in FIENS activities, because as mentioned by Professor Lawton today, it's difficult to work without using the social media. So we took advantage of that to bring the past fellows together and people who are also interested in joining FIENS activities, so that they get reliable information on the procedure or on application procedure for the different fellowships offered by FIENS. So I think I would just like to tell Dr. Soumia that we have a group. I got connected to her on LinkedIn. So I just want to get maybe your WhatsApp number to add you to the group, and any other person who is interested in FIENS activity, please do not hesitate to get in touch with us. So we'll keep you updated about the activities of FIENS.
Well, thank you.
We will put your contact information on the webinar as well, Ignatius, for the young neurosurgeons, because this is important. And if we look at some of the questions that I'm seeing in the chat, there are a need for people to be aware of these resources and what can be done. I know that also I would like to mention, Dr. Rousseau points out that the Global Neurosurgery Forum, brought together by Dr. Tariq Khan in Pakistan 2 weeks ago, has been a very, very important, significant worldwide effort to bring together those people outside of the various societies, et cetera, that are dedicated to global neurosurgery. And I think this will very systematically begin to look at how we partner together, breaking down the barriers of the different societies. I think the Europeans are also doing a wonderful job of this, as are the North Americans, in working together in various ways. For example, the effort in South America really represents 6 different high-income training programs working to develop an educational program for 5 countries under the leadership of those countries that are being served, which is really the root of success. Soumia, did you have any comments?
No, I'm just reading about the projects that Dr. Lasso is talking about, like the Global Neurosurgery Forum and the work with the upsurgeon. I think that one is extremely interesting, especially to the education of the young neurosurgeons and especially the residents.
Yes, and I think that that's very important because while it is very common to do education with cadavers in the United States, it is not in large sections of the world. And the upsurgeons have developed 3D printed models of brains, of vessels, of backs, of spines, which allow, with very good haptic interfaces, practice in simulation labs worldwide. And so this is the creativity that comes from, from really having forums like this where people can share ideas.
Yes.
Outstanding. Okay. Michael, would you have any last comments for us or advice for our future direction? I've heard phenomenal energy from the youth, phenomenal wisdom from the older people, and some coming together, such as the recent meeting in Peshawar, Pakistan, which makes me very excited about the future. You give us your thoughts as to the next directions for global neurosurgery.
Yeah, well, the thing that I keep coming back to is just how guys like us have been in this for a long time, and we have certain concepts of how teaching and education should go. But I'm always astounded by just hearing the younger generation talk, and I think the my parting words would be for the young generations to speak up and for us to listen and learn. I just find so many fresh ideas amongst that the young minds, listening to the participants of the hackathon or seeing what my residents do in trying to develop teaching tools, 3D printed heads instead of human cadavers, as you mentioned, which are so hard to come by. There's so many good ideas that are bubbling up in this direction, and I think we just need to listen very carefully, listen very intently to what's coming at us, and grab those good ideas and try and support them. Because while we may not have the insight that the young generation has, we sometimes have the power or the means to make it happen. So I think that's where we can help the most.
Yeah, and I couldn't agree more. The first step is to listen. To think we know the answers is a huge mistake. The people who have the questions are the ones that are in the area of need and are doing the work every day. And they have a clear understanding and tremendous insights as to how we can improve. And then we do that by partnering. So that's wonderful. I see that Gail Rousseau is on the call. Gail, do you have any last words for us to close out this seminar?
Oh, thanks, Bob. Thanks, Michael and Soumia. It's been a wonderful webinar. I'm delighted to have been with you and listen and learn from you. I agree with what's been said. I would just add one other thing that motivates me beyond the listening, and that is I do think in our globalized world that we in neurosurgery have acquired a second core professional responsibility. And that is that in addition to taking the best possible care of those patients who have entrusted their care to us, we believe that that is important. Then we have to, in a globalized world, believe that it's important for us to take our knowledge and experience and share it globally so that our colleagues throughout the world can, with our help and with the communications that we now have, bring it to others. So there's this double core responsibility: take care of the patient in front of you and help be sure that quality neurosurgical care is made available to everyone everywhere. And I think that's what animates neurosurgery now. It's the basis of global neurosurgery, and it goes beyond our profession and even beyond medicine in the good it can do in this world.
Outstanding. With that wonderful thought, I want to thank everyone. Thank you very much, Soumia and Michaels, for outstanding participation today. I want to thank all of the audience and the audience that will be viewing this online later for your interest in the patient care that we must provide. There's tremendous need, and it will be only met through the youth. And if we can be inspired by you, we can help. So thanks very much to everyone. It's been a great pleasure. On behalf of the Foundation for International Education in Neurological Surgery, I thank you and hope that you remain inspired to do this sort of service long into the future. Thank you very much, Jeannie, Maggie as well.
Bye, everyone.
Thank you.
Bye, thank you.
Bye-bye now. Thanks.